It's Rome and welcome to another episode of Homefront. Today I'm very excited. No, it's not Nurses on Set Day, but today we are going to speak with our Homefront correspondent who is out there in India. We have Dr. Krishna with us, who works alongside the Pediatric Emergency Department in Mount Hope, and he is part of the PED CARES Foundation. Now, Dr. Krishna unfortunately had to leave Trinidad and Tobago in August last year to go up to cremate his dad who passed away. Now, he's still out there in India, and he's just waiting for the borders to reopen to come back home. So, Dr. Krishna, welcome to Homefront. Thank you very much for being here with us today.
Thank you, Mr. Rome, and thank you, Dr. Paul, for having me on the show.
Right, Dr. Paul is here with us today, and Dr. Paul works closely with Dr. Krishna. And Dr. Krishna, I know that you are out there in Bangalore. So,
Yes.
and we heard, and we have been seeing across the world that all eyes are focused on Delhi in India. They have been hit hard by COVID-19. How are things in Bangalore, in your city?
Though situation is bad in Delhi, we are not far different from what's happening in Delhi. We are also in the same situation like in Delhi right now. In fact, the cases in Bangalore today are more than what are the number of cases in Delhi.
Wow.
Right? For the last 3 days, we had been overtaking Delhi. We have about 23,000 cases per day in Bangalore city.
Wow.
So we are
Why-
significantly...
23
sorry.
positive cases, sorry? Positive cases.
23,000 cases, positive cases.
23,000, okay, wow.
Why do you think that India on the whole was hit so hard?
There are multiple factors. Of course, the first and primary thing is we were completely having disregard for the safety protocols, right? We had a lull for about 4 months. So people thought they were almost winning the game with the COVID, right? The safety protocols were completely not being followed. Politicians had their elections, political rallies, the marriages, functions, everything was back to square one. Like they were almost like pre-COVID levels.
Like normal, they thought things went back to normal.
Yes. We were only about 10,000 cases in 1st of March, right? About 12,000 cases 1st of March. And by end of March, we went up to 80,000 cases. Wow. And by end of April, we reached more than 400,000 cases.
Yes, Rome. I can't imagine that.
Yeah,
Oh my
you can
goodness.
imagine that. And JP, you were telling me about the variants.
Yeah. So, Krishna, I wanted to ask you about that, though. Now, we have the Brazilian variant in Trinidad. What do you all have in India right now? What's causing it?
Actually, we have something called the double variant or the Indian variant.
It's a
double
the
mutant.
super Indian variant. Yeah, right, yeah.
It's also called, it has what is called double mutant, right? Okay. So it has mutation from one of the similarities which came from the Californian variant, which causes a lot of transmission. And the other variant consists of the Brazilian as well as the South African variant.
So we have so it didn't come from UK though? I thought it was a UK mix-in. So you say it's a Californian.
Yeah, I mean, the same strain, the mutants which you have two strains, L452R and E484Q, right? L452R is little bit, has a similarity to the California one,
Sure, right.
which increases the transmission.
Sure, right.
And the other one has similarities to both Brazilian as well as the South African variant, which they suspect is much more virulent.
Right, and deadly at the same time.
Yeah.
Than even the Brazilian.
Because the virulent, yes.
Wow. So that's why I'm now coming to, in terms of it spreading, is it spreading? You all are seeing a spread amongst younger people and children, or is it only in the elderly that you're seeing the spread?
No, not really. Actually, we are seeing much more cases nowadays in the younger population and children because the older population is fortunately immunized, right? That could be one reason why, I mean, we are seeing plenty more younger population being infected now.
Right. And the younger ones, Krishna, like the teenagers or the ones less than 10?
Both, I mean, teenagers have more symptoms, but the smaller children are also infected, but I think very less of them are being tested.
Right,
Because their symptoms are minimal.
So now it's moving, right? So you're saying that the young ones, like the little children, are being infected, but not showing, just showing mild symptoms. But the older ones now, teenagers, the 20s, the 30s, the 40s, they are getting sick.
Yes.
Essentially, yeah? Okay.
Between 20 and 50, many people are becoming oxygen dependent.
Right. And what is it like now in Bangalore, though? Give us a feel, a taste in terms of, I mean, you're there right now. What is it like to be in a city with all that's happening? We see the BBC News, so what's happening though?
Yeah, are you all under lockdown? What is taking place?
We were under a partial lockdown for the last 2 weeks, right? Where we had a window of opening from 6 to 10 a.m. for essential purposes. But from next Monday, it's going to be a complete lockdown for 2 weeks. It was only announced today, right? Okay.
Right.
Because they expected the cases to plateau,
Right.
but in fact, they're still going up.
Okay.
And what is it like in terms of the hospital? Because in Trinidad and Tobago here, we have our parallel healthcare system that is separate and apart, that deals with strictly COVID-19 patients. How is India dealing with this whole thing in terms of their healthcare system?
Yeah.
The situation is pretty grim, right? Because of the gravity of the situation right now, in fact, it is very disheartening for the healthcare professionals because there's lack of beds. In fact, absolutely finding a bed is a nightmare, especially if you are oxygen dependent.
Right.
Lack of oxygen, right? Fortunately, at least in Bangalore, oxygen, though there is deficit of oxygen, it is not like as bad as in Delhi, right?
Sure.
So getting a bed with oxygen has become very, very difficult to get. People are going to the other places to get a bed if it's not feasible to get a bed here.
Wow.
A bed like
Because
an
we are
ICU
adding,
bed.
yes, ICU or, I mean, nowadays actually we will not advise admission unless until they are almost oxygen dependent.
Right. Yeah.
So
So they will be at home
advice-
care unless they need oxygen.
So what advice would you give to because you were here, you worked in Trinidad and Tobago alongside
Yeah.
Dr. Paul.
Well, he's a consultant with us, in pediatric emergency.
What advice would you have to your Trini colleagues who work in the medical field down here, who are going to be battling this?
If you were advising the CEOs or the even the health administrators, what would you say? How do we prepare? Because we're having the Brazilian. So essentially, you're saying the Brazilian we're having, Rome, their mutant is worse than that. And so we're being hit by our Brazilian now, but we're not sure what's coming next. So how can we do this better, Krishna? We're preparing for upsurge.
We always had a fallacy thinking that the developing nations might be better off challenging the COVID.
Right.
Even when we were in Trinidad, I used to think that most likely we are much more immune than the developed nations, right? But after our experience now, I would say always be prepared for any eventuality, right?
Right.
So first and foremost, make sure you have enough healthcare professionals, both doctors, nurses, everybody.
So we might have to go to medical students. So it might be, you're saying, whatever we expect to happen is like a tsunami, right? So whatever we expect, it might be like the reality might be 3 times or 5 times.
That's what our cases skyrocketed in 2 months to almost 25 times.
Right. So whatever we
Right,
think,
okay.
25 times.
25 times. So whatever we think is our reality is for us to just go further. So it might be, are you saying it might be like get the medical students, get the nursing students, get all the health personnel we can, everybody?
Yes.
Is it an all hands on
That's
deck
exactly what is
situation?
happening right now in my place. All the medical students, including those in 3rd year, 4th year, and interns are all being offered privileges, like they will be given priority in postgraduate training.
Wow, so JP, it looks as though it's an all hands on deck situation with us here, because I remember when we were discussing the cases in Trinidad and Tobago and the rapid increase.
Yeah.
It was a situation where the hospitals weren't only running out of physical beds, but they were saying that each bed is associated with equipment
yeah.
and personnel.
Yeah,
So a nurse,
yeah.
a doctor, and people to care for them.
Yeah.
So maybe we might have to do that in Trinidad and Tobago, where we have all hands on deck and call out everyone, all the medical
Yeah.
personnel, even if it are people on vacation, or even maybe what about retired nurses or
Yeah.
retired doctors?
Yeah.
Would we have to bring them out to help this?
That's
Because
a good point. Yeah, definitely. Yeah, I think Krishna was actually telling me earlier that his cousin died. So I was asking him, what did we have any direct effects? And there, his cousin was 45 years old, no comorbidities, died from COVID. So he had to bury him yesterday. So I think, Rome, this is a real wake-up call. We thought we were doing all our stuff. We got a little bit slack for Easter time. And I'm seeing the tsunami coming with the Brazilian. So I think we have to wake up, because we have to now probably take all our resources. So we have two sets of things happening. The persons who are not healthcare frontline, stay at home.
Right.
The persons who are frontline, get all our artilleries together. Like, it's like almost like the army personnel now. We have to have battalion 1, 2, 3, 4 and getting ready for the tsunami that's coming.
yeah, yeah. All right, so we're going to take a short break.
Yeah.
We lost correspondence with Dr. Krishna, but we do want to thank him very much for joining us and giving us all of that insight right here on your home front. JP and I are going to still be discussing how we can get ourselves out of this situation
Yeah,
in
home
Trinidad
time,
and
room,
Tobago.
cuddle up, rain, home time. Yeah.
All right, so we are back. We have Dr. Krishna with us back on the line. What went on there, Dr. Krishna?
Sorry about that. We had a power failure.
Oh, we had power failure. Okay, well, we have you. We
Yeah,
have you
yeah.
back, and we're so happy to have you back with us. JP, we were just discussing in terms of the vaccine.
Yeah, definitely. So, Krishna, we have lots of things to ask you, because you're home front correspondent, right? So,
Yes,
in
yes.
terms of the vaccine, the AstraZeneca, I know India had that for most of the persons there. Is that covering your super Indian variant, that double variant? Rome, that sounds like a real horror movie.
Yeah.
Is that covering it? Is the virus sensitive to the vaccine?
Yes. Only today we had the preliminary findings coming out,
Yeah.
but the not complete analysis is not out yet. But they found it extremely useful, right? About 100,000 patients retrospectively studied. Only 1.5% had to be hospitalized. Those who were vaccinated even with one dose.
Okay. All right.
JP, and I
That's
was
really
to find out too, in terms of the AstraZeneca vaccine in Trinidad and Tobago against the Brazilian variant that we have, how effective is it?
Yeah, Prof told us it covers that also. So we're quite happy with that, just for us to actually get herd immunity. That's the issue right now. Get vaccinated. So we're talking about protection. But if we don't get vaccinated, we don't have protection.
Okay.
All right? Yeah.
Okay.
Yeah.
So, Dr. Krishna, we, finally, before we wrap up, we want to find out what could we do as the average citizen. I know you advise in terms of the medical personnel, but what could the average citizen in Trinidad and Tobago do right now? Because we are heading into that phase of where things are getting a bit out of control here. So what can we do as the citizens of TNT to prevent the situation that arose in India?
Citizens should follow the COVID bulletins being given out by the ministry time to time, right? And then they cannot be complacent at all, right?
No complacency.
No complacency completely. And then all COVID protocols have to be followed. That is a must. Please don't take it easy. Don't think that God is a Trini and then we should be fine.
You
right?
don't
Okay.
think
You know, he's been living here for a while.
God is a Trinity.
Because your cousin died, so I mean
Yes.
you're feeling it right now. Your relative.
I
you
had a lot
parents.
of people who were infected in my family, especially being doctors in the family.
Right.
A lot of my family were infected, and in fact, those who have really were affected were those who have not been vaccinated, who were thinking that probably they already had resistance to it, or they were very complacent, or some people had vaccine hesitancy. Unfortunately, one of my uncle was old and he was on. He was on blood thinners, so he couldn't take it earlier on.
Right.
But of course, he could have taken it now.
Well, he died also.
Yes, he passed away.
And
sorry
what would
for
you advise to those who are fearful of taking the vaccine?
Please, it's 100% safe. Now, almost throughout India, the people are queuing up for the vaccine. Unfortunately, we don't have enough now, right?
Right.
We were producing plenty earlier on, but because US had restrictions, they had a ban, which was just removed about 3 days ago
Right.
for the raw materials.
Right.
Because we didn't have enough raw materials to produce enough vaccines. And initially, because they were very complacent and the number of cases have come down, people had a lot of vaccine hesitancy.
Right.
Now people are queuing up, but they don't have vaccines.
Oh.
So essentially, Roma, hearing the key words that to me, complacency and just do it 100%. So, and I see us moving together because we're a whole nation. We have to do this together. So no complacency, and we have to just work with what the ministry is telling us.
Yeah.
Yeah?
Yeah. So, Dr. Krishna, we want to thank you very much for all of the insight that you have given us. And we not only want to say thanks to you, we want to also say thanks to the people of India, because India they were very generous in giving us, in donating vaccines to Trinidad and Tobago to help our vaccination drive. So we want to say thanks to you and thanks to the people of India very much. Thank you very much from our PD Cares Foundation and from Homefront. Yes. Dr. Krishna out there in Bangalore,
Take care.
Our Homefront correspondent. So, JP, this was a very insightful episode for me in terms of everything that we learned. And as you reiterated, we can't be complacent. And also, we need to start thinking about all hands on deck. As we move forward as an army to fight this.
Definitely.
So, we want to thank you all very much for joining us again on Homefront, and thank you very much to the PED CARES Foundation. Remember to keep on donating, and we're going to help the pediatric unit right there in Mount Hope, because the kids are our future, and we want to make sure that we support them. Remember, the PED CARES Foundation collaborates with schools and with organizations both locally and internationally to make sure that the youth get what we need for them to prosper, for them to survive, in terms of being the leaders, the future leaders of Trinidad and Tobago. Thank you very much for dwelling. So, what you fancy set now? Papa you. I'm Rom, this is JP. Thank you very much for joining us. We gone.